What is upper room UVGI for TB control? Imagine a room where the air is constantly being cleaned without anyone needing to do anything extra. That's what upper room ultraviolet germicidal irradiation is all about. It's a smart way to help stop the spread of tuberculosis bacteria in indoor spaces, especially in places like hospitals or clinics where many people gather. The system uses special lights installed high up on walls or ceilings, shining ultraviolet C light into the upper part of the room. This light is powerful enough to damage the DNA of airborne bacteria, including the bacteria that cause tuberculosis, making them harmless or unable to infect others. The key is that the UVC light is confined to the upper part of the room, so people walking around in the lower part are not exposed to harmful levels of ultraviolet light. The way it works is simple but effective. The UVGI fixtures are placed high up to create a zone of UVC light above the heads of people in the room. When air circulates naturally, or with fans, contaminated air from the lower part of the room rises into this UV zone. Once in the zone, the bacteria are exposed to UVC light, which damages their DNA and inactivates them. Proper placement and maintenance of these fixtures are crucial. The UV dose, which is how much UV energy the bacteria are exposed to, depends on the intensity of the UVC light and how long the bacteria stay in the zone. Usually, the UVC irradiance in the upper room is kept between 30 and 50 microwatts per square centimeter for optimal effectiveness. Air mixing plays a big role here. Fans or ventilation help move the air so that bacteria from the occupied space are regularly brought into the UV zone. This process ensures that airborne bacteria do not linger and continue to pose a risk. It's important to balance the system with ventilation so that it doesn't reduce the UV exposure time too much. Safety is also a top priority. These systems are designed to keep UV exposure in the lower part of the room well within safe limits for people, following strict guidelines for installation and maintenance. This method is especially useful in crowded settings or healthcare environments where the risk of TB transmission is higher. It offers a passive, continuous way to reduce airborne bacteria without relying solely on air changes or filtration. When combined with other infection control measures, upper room UVGI can significantly lower the chances of TB spreading from person to person. In summary, upper room ultraviolet germicidal irradiation is a scientifically supported environmental tool that uses targeted ultraviolet light in the upper air of indoor spaces to kill or inactivate tuberculosis bacteria. It helps protect public health by reducing transmission risk while keeping occupants safe from UV exposure. Always consult healthcare professionals for personalized advice and proper system installation to ensure safety and effectiveness.